Ever wonder why vitamin D deficiency is a global health issue? Well, it turns out this sunshine vitamin plays a crucial role in our overall health. For starters, vitamin D is indispensable for the maintenance of our bones and teeth. It aids in the absorption of calcium and phosphorus, two minerals that are fundamental for bone health. But that's not all. This versatile vitamin also bolsters our immune system, helping us ward off illnesses and infections. It's like our body's inbuilt security guard, always on duty, always vigilant, and there's more. Vitamin D contributes to the normal function of muscles, keeping us strong and agile. It even has a role in brain function, impacting our mood and cognitive abilities. So, you see, vitamin D isn't just another vitamin, it's an unsung hero, silently working behind the scenes to keep us healthy and functioning at our best. So, vitamin D takes on several roles in our bodies. But what happens when we don't get enough? Vitamin D deficiency is more common than you might think. It's a condition that can silently creep up on us, often going undetected until more severe symptoms begin to surface. Key signs of vitamin D deficiency include persistent fatigue, bone pain, and muscle weakness. But what causes this deficiency? The most common culprit is lack of exposure to sunlight. Vitamin D is often referred to as the sunshine vitamin because our bodies produce it in response to sunlight. So, if you're cooped up indoors most of the time, chances are you might be lacking in vitamin D. Certain medical conditions, such as kidney and liver diseases, can also interfere with your body's ability to convert or absorb vitamin D. And let's not forget dietary habits. If your diet lacks vitamin D-rich foods like fatty fish or fortified dairy products, you could be at risk. Now that we know the signs and causes of vitamin D deficiency, how can we ensure we're getting enough? Getting enough vitamin D is easier than you might think. It's not some elusive, hard-to-attain nutrient. In fact, it's quite the opposite. The primary and arguably the most effective way to get vitamin D is through exposure to sunlight. Just a few minutes of sun on your skin each day can help your body produce the vitamin D it needs. However, do remember that prolonged exposure to sun without protection can be harmful, so it's all about finding the right balance. If you're living in areas with less sunlight or if you're indoors most of the day, don't fret. There are other ways to get your daily dose of this vital nutrient. Your diet plays a significant role here. Certain foods are naturally rich in vitamin D. Fatty fish such as salmon, mackerel, and tuna are excellent sources. Cheese, especially Swiss and cheddar, and egg yolks also provide a decent amount of vitamin D. But what if you can't get enough vitamin D through sunlight or diet? This is where supplements come in. They can be a reliable source of vitamin D for those who might be deficient or can't get enough from the sun or their diet. They're available over the counter and can be taken daily, but it's always a good idea to consult with your healthcare provider before starting any new supplement regimen. So, there are many ways to ensure you're getting your daily dose of vitamin D. But how much should you be getting? Determining the right amount of vitamin D can be a bit tricky. The recommended daily intake of this sunshine vitamin varies based on multiple factors. Let's dive in and understand how much of this essential nutrient is needed for different age groups and genders. For infants up to 12 months, the recommended daily intake is 400 international units. As we move into the age bracket of 1 to 70 years, including both men and women, the dosage increases to 600 international units per day. For those above the age of 70, 800 international units are advised to compensate for the reduced skin ability to produce vitamin D. However, these are just guidelines. Your individual needs may vary based on your lifestyle, overall health, and even where you live. For instance, people who spend a lot of time indoors, those with darker skin, or inhabitants of northern latitudes might need more vitamin D. Now, you might be wondering about the difference between vitamin D and vitamin D3. Well, vitamin D is a group of fat-soluble vitamins. Vitamin D3, or cholecalciferol, is a type of vitamin D that our bodies produce when sunlight hits our skin. It's also the type of vitamin D that's most often found in supplements and fortified foods. Remember, vitamin D is essential for our overall health, so make sure you're getting enough, but don't overdo it. Always consult with a healthcare professional if you have any concerns.